Welcome to the Aging with Options Show. Thank you so much for joining us. I'm Chris McCutcheon. The Aging with Options Show is about seniors and for seniors and their loved ones. Our passion is to provide interesting, relevant content for seniors and their families in the Louisville area. We discuss topics such as healthcare, senior living, long-term care, aging in place, local senior events, products, services for seniors, and a variety of other topics facing today's seniors and their loved ones. So today, 53% of seniors use more than 5 prescriptions. Inadequate drug therapy costs $77 billion a year in the U.S. Our topic today is medication management. For our show, I'm delighted to be joined in the studio by Lynn Harrelson. Lynn is the owner of Senior Pharmacy Solutions and is a senior care pharmacist with over 35 years' experience in providing services to seniors and others taking multiple medications. Lynn, thank you for joining us.
Thank you for having me.
Good to have you here. Certainly an interesting topic and one that I think may have some surprising information for many folks. But to begin with, Lynn, tell us, you are what's called, as I just described a minute ago, you're a senior care pharmacist. Mm-hmm. So tell me, what's the difference about your expertise as a senior care pharmacist?
A senior care pharmacist is an individual who has focused their practice on taking care of seniors, and learning more about how the aging body handles medications. We have a better understanding of how those medications are used and the multiple medications are used and how they're eliminated. A lot of the problems we'll see better as a medication rather than simply aging. We're just a little bit more attuned to the use of medications in the seniors and the problems that those medications cause. It is a special designation that was developed about 20 years ago from the National American Society of Consultant Pharmacists, and those are individuals who provide services to patients who reside in long-term care facilities, nursing facilities, and we are called senior care pharmacists.
Great. Good information. So, Lynn, what got you interested in this field? You had many options as a pharmacist, I'm sure.
Yes. I guess it really started when I was younger. My grandfather, whom I was very close to, had an illness that was quite debilitating, and when I was 12, 13, and 14, I helped take care of him during that illness and his decline. And he was someone that I loved and respected, and I just grew to like seniors. And I had an opportunity while I was at the University of Kentucky College of Pharmacy to help implement a program for seniors in the Lexington area. They had a prescription drug plan that didn't cover compound prescriptions. And then as a student, I was a lab assistant, and we worked out a service and a program for those seniors. And part of my responsibility was actually getting it delivered. And when I walked into a lot of those homes, I saw what I would respectfully call a train wreck. There were medicines from one counter to the other. There was no organization. The seniors could not tell us what they were on, how they took them, and I thought, this just can't be happening.
There must be a better way.
Yes, it had to be a better way. So I came home back to the office, what I call the office. It was my classroom, and I asked my professor about it, and he says, well, you figure it out. So I came up with a plan and actually started a service to that group of individuals, very similar to what I'm doing now. It was where I cut my teeth on this medication therapy management. And got them organized, got them engaged in what needed to be done, how it needed to be done, had things on paper, things cleaned up a bit, and it worked out well.
Well, we're focused on topics that are of interest to seniors, so we're speaking specifically to seniors and medication management. So let's just jump right in. Mm-hmm. Tell me, Lynn, how many medications on average is the average senior taking?
Most of them are taking 8 or more. And when you say medications, you need to include not only prescriptions, but the non-prescription or over-the-counter items. the nutritional or health food type supplements, vitamins, and minerals. Many people forget to include the samples that they're getting from the physician. Mm-hmm. The food that some individuals take can also interact with their medicine. We don't call it a medication, but it also has some problem in causing some of the interactions with the medications. But most of them are on 8 or more medications.
Wow. And we'll talk a little bit more about that, how that impacts things. But what do you see as some of the problems that seniors run into with their medicines?
Well, the more medicines they take, the more opportunity they have for getting them mixed up or not taken at the right time, maybe taking 2 of the same medication rather than taking 2 different medications. A lot of the medicines today are white tablets, and it's confusing. People don't see their medications, can't identify them as easily. So there's what everybody thinks about is just the medication mix-up, and that does happen. What happens more and more frequently now is that seniors, as they decline, as their health diminishes, their body is not able to eliminate the medicine as well as they had before. And the individuals are taking the same dose that maybe they were taking in their 20s, 30s, 40s, and 50s. Their body can't handle it. It can't be eliminated. Mm-hmm. So we see the dose that's not appropriate. We see the dose mix up. We see medications that are used past the time that they need to be. We have situations where medications are discontinued, and there's some confusion, and the senior continues to take the medicine. We have situations where patients are taking 2 medications under different names. Maybe they're taking a medication and it's labeled as a brand name, and then they're taking the same medication and it's labeled as the generic name, and there's no understanding that those are indeed the same medications. Mm. Sometimes patients are taking 2 medications from the same therapeutic class. Sometimes that's caught through the prescription drug plan, but more and more patients are using medications outside their prescription drug plan, so there's not that one overall review. So they may be taking one medication for blood pressure in a therapeutic class, and they get that at a pharmacy where they would pay $4, and they would get another blood pressure medication through the prescription drug plan, and they're actually over-treating their blood pressure. So it's very, very complicated because we have seniors using more physicians, getting more medicines, using more pharmacies, and not actually having a very good structured way to control or monitor their medicines. Mm-hmm. So you can almost look at anything, and it could be a problem for seniors when we're looking at their medicines.
Mm-hmm. So give us a sense, if you would, Lynn, how serious is this problem with managing multiple medications mm-hmm. and all the things that you just described that could potentially cause some confusion and lead to mismanagement of medications? How common is it? How serious of a problem do you think it is?
What was the quote that you had when you introduced the amount of the billions and billions of dollars?
Yes, $77 billion a year just in the U.S. in inadequate drug therapy costs.
Okay. That's the amount of money that we spend on our medications. We spend almost the same amount of money on handling the medication-related problems as we do on our medications. So we're actually doubling the cost of our medications just because we're not managing how they are being, the outcome, the results of how
we spend as much money handling the problems with medicines as we do for the medicines themselves.
That's correct. And wow. What's really striking is that most people don't even think about that medications can be considered a problem mm-hmm. or the outcome of the medications, the use of the medications. Mm-hmm. As a healthcare practitioner, when I see a patient and they come to me and they have a rash, the very first thing, and everyone else that's in healthcare, if they see a rash in the patient, the very first thing that they think about is, what new medication have you started on? Because they think it's an allergy. Well, what we need to do in our healthcare professions is to change the paradigm that when somebody comes to us and presents with or has complaints of drowsiness, sleepiness, the very first thing that we should think of is the medicines we're taking. Or if you see someone confused or not getting around as well or having problems with just day-to-day activities, don't make the rush to judgment that it's purely getting older. It could very well be the medicines they're on. We need, first off, to think that the problem is medications.
Gotcha. Very interesting. My guest in the studio is Lynn Harrelson, a senior care pharmacist and owner of Senior Pharmacy Solutions. We're talking about helping seniors use their medications more wisely and improving health and conserving resources. Lynn has an innovative program for doing that. We'll talk more about that when we return. We'll take a quick break and be back with Lynn and more topics of interest to seniors in the Louisville area right after these messages. You're listening to Aging with Options on 970 WGTK.